Hi, my name is Carly Miller. I'm going to be showing how to do blood administration. So first what we're going to do is we're going to verify the physician's order and then make sure that the consent is signed. I'm going to introduce myself to the patient and explain exactly what I'm going to be doing, as with anything that we do. I'm going to get all the stuff I need, which I've already done for this video, and I will initiate the blood transfusion record. I will go ahead and take the patient's, all of their vital signs. I will record those in their chart and assess for cardiac and respiratory systems especially. I'm going to look at the expiration date on this blood bag. In this scenario, we'll pretend it is not expired. And not only will I check this, the nurse here will check this, so I'm going to check it, and then you check it as well. That's checked. So I'll check the expiration, then I'll check the name and the number on the patient's wristband, and it should match what is on this bag. So can I see your wristband? I'm just going to compare. Okay, perfect. And I'll have the second nurse do that as well. Okay, now we're going to check the identification number, the ABO blood group, and the RH compatibility. So I'm just going to look at that and just double check. Whoops. So we're just checking all that. I'll have the second nurse check that as well. Okay, they checked it. I'm now going to wash my hands, and I'm going to put on gloves. I'm going to open and prepare everything. So I've just opened the normal saline and hung it up here. I am opening my tubing. And I'm going to go ahead and close all the clamps on the tubing. I'm going to close this and this and this. And now, going to insert the spike. I'm going to take off the sleeve and not touch this to anything. And then I would take off the cap off of here, and I would insert this into the normal saline. Okay, that's inserted. We're a little tangled. Okay, making sure to keep all the caps and stuff safe and clean, and keeping that part sterile, because that's the part that is touching what is going straight into the patient's bloodstream. So I would put the tubing into the pump, and I would set it at less than 50 milliliters per hour for the first 15 minutes. I would document as needed on the transfusion form. So we would connect the Y tubing here, maintaining sterility. Voila. Okay, and we would begin the transfusion, making sure to document everything. You stay with the client and document as needed, but make sure to tell the patient about what they need to report if any symptoms happen, such as tremors, chills, not tremors, fever, itching, anxiety, flushing, difficulty breathing, chest or back pain, muscle pain. I think that's pretty much it, but we need to stress to them that if they have any of that going on, that they need to tell us immediately. We'll go ahead and assess the patient's vital signs again after 15 minutes, even though we just got that baseline before. It's really important that we get that and make sure there's no notable fluctuation in their vital signs. I think that's pretty much it for the initial part. If they don't have any adverse reactions, no sign of reaction, we would bump the flow rate up to 125 to 200 milliliters per hour, depending on the order, and then we would assess them every 30 minutes until it's completely done. And that is pretty much it.